Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo, who you were doing the 21st century thing this week. And
I went to a family practice medicine conference,
which
was located in Hawaii, but for me it was in my kitchen.
Aw.
So I Zoomed.
That's too bad.
Which is actually more complicated than you think, considering the time difference. So, and it was weird to see a bunch of tertiary care internists in shorts. Kind of scarred.
Were they just like out on the beach for this or what?
Yeah, they only had half day of lecture, and they started at 6:30 a.m. Hawaii time.
Oh, wow.
And each of them presented like their favorite Hawaii thing to do.
Oh.
Like swimming with sharks, or, this particular beach, or love this restaurant.
Oh, wow. So they start at 6:30 in the morning, so they're done by like noon?
Right. So most of the people came from, time zones to the east.
Yeah,
right?
sure.
And so they were, at least it was a 5-day, 6-day conference. At least for the first 3 days, they were on Eastern time.
That sounds
biologically.
That makes sense.
Yeah. So, but I learned there was a lot of good information. But the talk that especially caught my eye was titled Advising Patients About Vitamin, Nutritional Supplements, and Exercise, and was presented by Jeffrey Tice, T-I-C-E, who's a physician. But what I focused mostly on was on vitamin D, because we check vitamin D constantly at UHS. Mm-hmm. I would say it's fair to say anybody who's an adult probably gets yearly levels checked. Mm-hmm. And I've seen some super low levels.
Sure.
So normal's about above 30. And I see a lot of 9s, 5s.
Oh, wow.
Yeah, 17s. So we spent all this time focused on getting vitamin D to people, which is kind of a big deal, because the only pharmacy that'll cover it is the Padua pharmacy. And most of the time people get directed over the counter. So I'm wondering, why do we do all this stuff? Well, low vitamin D levels are associated with a lot of bad things. So I whip through the list: cancer, cardiovascular disease, MS, type 1 diabetes, rheumatoid arthritis, influenza, colds. So upper respiratory infections.
Oh, okay. That's what a URI is?
Yeah.
Okay, all right.
Yeah, that's in our talk. Chronic pain and total mortality. All-cause mortality. If your vitamin D level is low, dun, dun, dun.
So if your vitamin D level is low, but this isn't like a causation kind of thing. This is just it's a common factor.
Observational.
Yeah, right.
Right, and so is the study that he presented.
Wow.
Yeah.
Wow.
Yeah. So he talked about a trial, and I'm sorry I didn't get the name. I was madly taking notes, but 26,000 patients with an average years of 67.1, so adults, kind of elderly, I guess you could say. 51% female and mostly white, but they tried. Mm-hmm. And they included Asian and people of color, but I don't recall Native Americans being part of this. And they were given 2,000 international units of vitamin D, which is, the recommended RDA is 400. So 2,000 is not as high as a lot of people take, but higher than what it says on the bottle.
Right.
Okay. And like we just said, this was an observational study, so hard to draw conclusions, really. But the conclusion they did draw is there was no effect on rates of cancer, cardiovascular disease, or death from any other cause.
Really? So
kind of like a loss.
It's like the reverse of what was just said, right? I mean,
right.
That's wow.
So there must be another way to look at it that we haven't figured out yet. There was also no benefit for osteoporosis. They said it did help increase bone mass, but still risk of fracture went up. So more bone, but apparently schlocky bone or something.
But not brittle bone?
Yeah, not really. Wasn't help. Although they did say that if you were like super ill, frail, malnourished, and in bed, that you might benefit from it. But Josephine average didn't benefit from it. This was interesting. No benefit for acute COVID. And we've talked about vitamin D on this show before as being a cofactor in who gets super sick with COVID and who doesn't.
Right.
So these observational data are in conflict with those data. But people who had higher levels of vitamin D did get fewer colds.
Okay, so that at least held up.
Right.
Wow.
And so considering all the misery, I worked at acute care clinic at Del Norte Community Health Center yesterday from 10 to 2, and people that have a cold really are unhappy, especially if it goes to about day 7 to 10. Although most viral syndromes, that's another way of saying cold, although a little more generalized, they last for 14 days. So you're not miserable the whole time, but you're definitely not well. Now, this study was also looking at other supplementation, specifically with vitamin E, beta carotene, omega fatty acids, and calcium, and then folate. So the bottom line is that the only supplementation that was maybe helpful was folate
for pregnant women,
and only during pregnancy or
and
preconception.
Folic acid, is that the same thing?
Same
right?
thing.
Yeah, sure, okay.
And so everything else that we kind of, these are antioxidants, right? And we kind of spend a lot of money on them.
This is
a
wild.
Swing and a miss.
This is wild.
I know. I thought so too.
Okay, so
this is only one study, okay? So there is some talk in the medical community. I don't know if you remember Dr. Chris Cutter, who was here behind the hospital. Super great doctor. I was really fortunate to work with him for a while. His theory was that vitamin D, getting people to normal levels, didn't do anything. That low vitamin D levels was a marker for just generally poor health, poor protoplasm. So if you're looking at horse in the cart, we're trying to put the cart in front of the horse. And Chris Cutter, in his usual monosyllabic brilliance, looked at it the other way.
Wow.
And I think he might be right, but, we need more data.
But, okay, and it's the same, but they're also, okay. So there was one, I just read a couple of weeks ago, some, online, and it was it was an article, and it was this nutritionist. It wasn't an online nutritionist. The guy was an actual nutritionist.
Okay.
And they asked about like supplements, things other than, just diet that you take. And he said there were just a couple that seemed to have any sort of effect in his estimation. And he took a multivitamin just to cover all the bases, he said. Although even though there was no indication study-wise that multivitamins actually help in any appreciable way. Omega fatty acid, he said you needed that and acted like there was some sort of like justification for it. And vitamin D. And that was it. And he said everything else basically hokum. You eat.
Expensive pea.
Eat right.
Yeah.
But even he had these three that in this one study.
This study does not support that. Yeah.
Wow.
Yeah. So that's kind of wild to me, actually. So his advice, Dr. Tice's advice, was like, who's the one that he's been writing books on nutrition? I think his last name, it's not Polakar, is it? Something like that. Anyway, his advice is eat real food. And I've heard that expressed, eat food that your grandmother or great-grandmother would recognize.
Right.
Don't eat too much. So that goes along with the Blue Zone recommendation in Okinawa. So eat to, you're about 80% full. Okay. And mostly eat vegetables. So kind of avoid meat. But fish is okay. So pescatarians do just as well as vegetarians or vegans if you're looking at health. So that was his bottom line, at least conclusions that he drew from this study.
What do you make of all of this?
I'm going to stop taking vitamin D, I think. My vitamin D level is about 50.
Oh, okay.
Yeah, it
Okay.
went up from like 34, which is low normal, to
And
50.
you don't think there's any?
Yeah.
Huh.
But I don't usually get colds. So
Yeah.
even though I'm hanging out with sick people all the time. So interesting. And when I did get COVID, I had stopped the D for a while.
Really?
So I don't know. I'm still a little hung up
I
on
take
that.
vitamin D every day and omega
How much do
omega
you
fish.
take?
Oh, I forget what it is. It's not 2,000, but it was above the whatever the recommended.
Yeah.
And what's an international unit? That just makes me angry.
I have no idea.
Really? Yeah, because
A teeny little tiny quantity.
because it's like an international. I mean, wasn't metric supposed to do? I'm sorry, I'm looking this up.
I don't think this is metric.
I know exactly.
It's not milligrams, no.
But wasn't that the point of metric?
Right. You can prescribe vitamin D in milligrams, but no, the pharmacist would go, what? So the other thing, too, he said, and I didn't really include it in my outline here, but people in general who take multivitamins have an increased cause of death from all-cause mortality earlier on. And
Really?
And what they think that is, first of all, multivitamins, I mean, defining a multivitamin, that's a little bit hard to specifically in a scientific way understand.
Yeah, it seems
But
kind
they
of a
think
broad
if
category.
somebody has a cancer, and we probably do have like little cancers that are being cleaned up and disposed
Like all the
of.
time, right?
All
That's-
the time,
yeah.
that the vitamin actually feeds it.
Wow. Okay.
Okay, because think of what cancer is. It's aberrant cell growth, and that usually happens at a high metabolic rate. So it needs resources, and you're kind of handing it that with a multivitamin. Assuming that what you buy at store X is what you think it is, which might not be.
Right, exactly. That's also an issue. But wouldn't you be doing the same thing if you were just eating right then? You know, instead of taking a multivitamin?
I think that addresses more, although they didn't say specifically, you're right, but people who take like super high doses of stuff.
Oh, okay. Which
Because
that's
I
gonna be-
take 5,000 international units of vitamin D, and that's kind of high.
I assume.
Yeah,
I'm
but-
trying to figure that out still.
But I'm also a postmenopausal female who doesn't want her bones to like get all weird.
Right, but again,
But what their findings were is that thinking may not necessarily be true.
wow. But there's again, it's an observational study. There's
yeah.
so many variables
Yeah.
to correct for in something like that. But
So
How-
let me set the room in Hawaii. Not only are they all in Hawaiian shirts and shorts and tevas and stuff, but these are not family practice doctors. They're a little higher on an imaginary hierarchy. They're internists, right? And they're internists who are employed by UCSF. That's tertiary care. So that you could argue that they're the best and the brightest.
okay.
Among us, although you could also argue they have no clue what Delaware
Right, they're
doesn't have.
completely detached,
I mean,
yeah.
they're talking about advanced cancer treatment, and I'm going, yeah, we don't do that. you
Yeah,
know?
no. If you,
Yeah.
that's when you find it. Is when it's advanced. Oh my god.
Right. So now I can read a paper and kind of understand it a little bit, at least the abbreviations. And that doesn't do much for my practice, but they. So this is their conclusion, and I thought it was shocking. And it also, at least in this room at this time in this conference, I mean, doctors don't push big pharma. At least these doctors didn't.
Well, and would that count? Is big pharma the same as big supplements? I mean, it's a different kind of.
It's a lucrative business, right?
Sure.
Yeah.
But does it have the same sort of cachet in the exam room with a doctor that big pharma does? I mean,
No, it has zero.
Right, exactly.
It's all zero.
So that might be another reason why they don't push it.
Right. They advertise to us, but we ignore the advertisements.
Right. Because you go, GNC, why should I care? You know, exactly.
Right.
But I just Googled because I wanted to see it in 2021, the supplement industry, the supplement market size, the market size. So I guess the amount of money to be made from the market or that was actually made, $149 billion. And it's expected to be 240 by 2028. So I don't know how that compares to big pharma in general, you know, and it's certainly you're not going to get the same sort of, I guess, big supplement goes directly to the consumer, right? That's who it's marketed to.
Well, a lot of drugs are marketed to consumer.
That's true. That's true.
You know, some days I feel like a Z-Pack vending machine.
Really?
You know, no, you can't have it for your viral syndrome.
You're not a very good vending machine then.
Yeah. But yeah, that's also a little bit of what telehealth is.
Right.
Because how can you do an exam on somebody when you're virtual, right?
Yeah, yeah.
And so, patients all the time want it to be the solution for their upper respiratory infection or sore throat or cough or something. And it's insane to me how people prescribe. Probably the infectious disease guys would lose their minds.
Right, right.
They saw, I mean, it's essentially an antibiotic cough syrup vending machine.
Wow.
So just tell me what you want.
Yeah, yeah.
So anyway, I thought that was super interesting.
That's just...
And then he goes on. He also addressed exercise, and he was the closest to a family practice doc, because this is all really basic family practice kind of stuff.
Uh-huh.
And he gave another lecture on obesity that was really interesting. But talking about exercise, he had data that suggests that exercise is more effective than selective serotonin reuptake inhibitors. Those are Prozac-like drugs that are used for depression. Mm-hmm. So they compared him in a head-to-head trial. I don't think it was double-blind, though, because it's a little hard to disguise that you're walking through the redwood as opposed to taking a pill.
Placebo forest.
But exercise not only was better, it was significant.
Wow.
It was super significant.
Uh-huh.
And so all of you out there who are looking at your Paxil bottle or your Lexapro bottle, so paroxetine or escitalopram, I think, do not go off of it, because going off of SSRIs abruptly is bad for a number of reasons.
Right, yeah.
Don't stop your meds, but consider adding exercise to your antidepressant efforts.
Wow.
And that Del Norte has. Mm-hmm. Yeah. So we're big fans, right?
Oh, yeah.
So walking...
I'm dressed to go do that when we're done here.
I've got plans to do it too. And that's one of the things they said. They plan out your week around exercise, and and they were advocating mostly for walking and running. Okay. Mm-hmm. And they want people to, if you're going to walk briskly so that you can talk but not sing.
And what helps is if you're here in Del Norte and you do like I do, and you like to walk in places adjacent to the lake. I like that a lot. Redwoods are nice, but there's too many people. You go out to the lake.
It's crazy.
There's nobody, no locals. There's lake people who are the regulars. It's kind of fun. Right. But walking out there and starting about a week and a half ago and going all the way until the next time it's cold. So next week, no, going all the way until September, October, it's mosquito season. That also helps you walk briskly. I was thinking about, we're getting a better walk. We're getting a better workout out of this now. Last time Lisa and I went walking, because these big bomber mosquitoes are clouding up around you when you stop. But that's... So, I mean, I've heard the same sorts of things, although, I mean, it's obviously they're talking about aerobic exercise in this regard. It's the breathing and getting the blood moving. Because,
aerobic exercise, I actually think of running is that. This is walking briskly. Now, for an old lady who walks funny, that's like...
But that's what it's saying. It's like, do the aerobic to the best of your ability. That's what that is code for.
Yeah, but I also think part of what they're saying is they don't want you to meander. Like, I've got one dog that walks really fast and one dog that has to pee on everything.
Right, yeah.
So, yeah.
No, I get that. I understand that too. We play fetch, and it's a lot of stopping.
Right.
To play fetch with it.
Yeah, there you go. It's not like they're in charge of our lives. Let's just admit it, Paul.
But it's like definitely, and how long we'll live too. Now,
apparently.
but it's But I guess what I'm getting at is there are other kinds of exercise, and I don't know, like anaerobic exercise, but like resistance and weight stuff.
Sure.
That has, it seems, So here we're talking about specifically depression, whereas other kinds of exercise, like the weight stuff specifically, has been talked about. Building muscle mass is thought to be beneficial for protecting. You're not going to get the Alzheimer's so bad, and that's a whole different sort of thing. But I just wonder about the depression and that other kinds of exercise too, or is it mostly toward the aerobic that keeps you from getting depressed?
Well, I think the reason he was talking about walking and jogging so much is because there's really almost zero monetary input to it. I think he was trying to make accessibility.
Well, yeah, and that's why you go, hey, hooray, soccer, because all you need is a field and the ball. I get that, but still, that's just scientifically speaking, I'm just saying.
But he said, so we all know 150 minutes weekly is what's commonly recommended for general good health. But he said if you want to lose weight, and exercise is not the big road to weight loss, although it's highly recommended, and for me it was way more successful. But you go up to 300 minutes weekly, and he said use a biblical model. So exercise 60 minutes a day for 6 days, and then on the seventh day rest. He doesn't want people to wear out, I guess. So 300 minutes a week if you want to lose weight. But this is helpful to me. I kind of do this. I plan it out. Where I hike today has been known to me and planned out, looking at the weather, anticipated happily for about the last 5 days.
Wow. Okay.
So, every day I think, depending on whether it's a work day or not a work day, I've got a plan on what I'm going to do, how long I'm going to do it, and where I'm going to go.
Okay.
So that's kind of like planning out meals. Now, some people, their lives just don't roll like that. But he says if you can get in the habit of doing it, then you're more likely to do it.
Sure.
And then if you have somebody that goes with you, of course, you have accountability.
Yeah.
Hypothetically.
I'm totally opposite. I do not plan, other than knowing that I walk every day.
Yeah.
And so what happens then? I don't know. Where am I? What do I feel like? Where do I feel like walking today? What's the weather like? All that comes into play like day of.
Right.
I can't plan that stuff ahead.
If I plan ahead, then if somehow the weather changes and it's raining and I can't, and I'm like,
yeah.
So I'm kind of looking forward to it. So it makes exercise like a more pleasurable thing for me.
Yeah.
And I should also mention we have a pool. UHS patients have access to the pool on Wednesdays. And it's super easy. All you have to do is write your name on a log, and then you go in. I think it's 7 to 8:15, something like that.
Free of charge?
No, it's paid for by UHS, I think. But I don't know.
For the patient.
Yeah, for the patient. But they also have ways of making it a little bit cheaper. So our pool is like one of the best resources we have in the area. We also have a bowling alley, which I've never been in there, but I don't think it's hugely expensive. Nobody has ever raised objections, and would be a good place for kids. And then when it's raining, you've got Home Depot. And then a lot of people talk about treadmills, which I find deadly boring, but I can go a little bit longer on a treadmill. So,
yeah. Get a rain suit.
Yeah. Patagucci is what my kid would call it.
Patagucci. Yeah. To have, that's funny. That you get the rain suit, get out and do that. That's what we do. That's and just to be able, rain suit and watertight shoes, and then you don't have to worry about the rain. And when we have like what used to be normal years, like we had this year, where it's been like, I don't know, 9 months of rain, it feels like you gotta come.
We're all
face to face
miserable
with it.
and depressed and missing our walks.
No, I didn't miss the walk. I still got miserable, depressed because I got tired of the rain. But that was just sick of that. But the I don't know. I don't know about going and walking around a store. I don't know if I could bring myself to do that. But again, I've never lived any place where you go to the mall and do laps because it's 30 degrees below outside in the Great Plains or something. I don't know. This is really interesting. This is really, really interesting. Wow.
Yeah. It was a great conference.
So it just kind of we set up all these systems. We do all of these things. We create whole industries I don't know, to make things more effective, to do this or that with it, to do even just silly things like, that aren't things at all, like, to cure our halitosis, which was invented by the people who made Listerine.
Now, what makes you think that making money is not part of that?
That's exactly what I'm saying. Making money is totally a part of it, because what comes down to it is the best way to live, it seems to be. The best way to exercise, the best way to eat is as simply as possible.
Right.
On a human scale. You don't need all of these machines and systems and plans and things. Here's what you just eat. Eat smart and not too much, and mostly vegetables, and exercise on a human scale. Do your walking, your running, use your
stuff your grandmother would recognize.
Yeah, exactly.
We keep coming back to this. Now, you talk about how people take control of their health here in Del Norte. Here it is. We're getting hit over the head with a hammer here.
Yeah.
It's diet and exercise, folks. There's no medicine that's going to save you. Wow. Unless you have a specific, hard to solve problem that you need to maximize your resources for. So I'm not saying that going to the doctor's pointless.
No.
But there's a lot you can do to help yourself, especially if you have chronic pain. And it's hard to get people to realize that because, they're not super comfortable moving around and things like that.
I had a blood work and months ago, and had to bring my cholesterol and my blood sugar down. I'm still waiting to hear about the blood sugar because they evidently didn't test for it. I have to go back in for another draw. Okay. But the cholesterol is all down and manageable now. And other things like plantar fasciitis that I had for most of this last year is gone. So there was like a little chronic pain sort of thing, and this condition. And what treated it? Losing 25 pounds. That's what treated it. That's what made both of those things better. And
it's so hard to do. But everybody wants, and I could talk. This physician, Dr. Tice, also talked about things like semaglutide, which is known as Ozempic to most people. And he said that it's not going to jumpstart you. You hear that, people out there? It's not going to jumpstart you, and that you have to commit to diet and exercise changes before you have an opportunity to use this med. And this med was thought to be a lifelong commitment, but insurance companies, it's expensive. So insurance companies and suppliers, it's also hard to get, don't really see it like that. And it really circles around. He talked about all the diet stuff that was available over, the course of his career, which my guess is about 30 years. And he said it did harm. Every single one of them did harm to people. Wow. And none of them really solved the problem. So people would lose weight while they were on it and then gain that and more. Yeah. And they weren't doing what they needed to do with exercise, with paying attention to what they eat. I think the good probably news, sleep too.
Yeah, right. That's got to be a huge thing. Right. And as I get older, I realize just how huge that is too. Right. But the what's reassuring about all of this is talking about health in general, mortality, all causes, all of that stuff. Right. What you need, you have already.
Yes. Most people
neat.
have. Yeah.
Most people have. Sure. Right. Yeah. Exactly. Right. So I find that reassuring. That to me is the
and it's not complicated.
Yeah. Exactly.
That's what I thought was so fascinating.
Wow. All right. Well, let's go about our day and let's go out for our walks.
That's right.
All right. Any thoughts about next week?
Yeah, next week, Dr. Terry Raymer is going to be on by telephone because he lives in Humboldt County, and he's going to talk about preventing type 1 diabetes or type 2. Preventing type 2 diabetes, and he's talked to us before about flu shots, and he's amazing. Right on. And I got a feeling he's going to circle around to the same theme.
Probably so, huh?
Now that I'm saying it, but I've got a lot of questions for him, so we'll see what he has. He's remarkable in this field of medicine.
Well, fantastic. I look forward to that and look forward to our next conversation. Lynn, thank you so very much.
Sure.